No matter what's going on in the world, you show up for family medicine. Because of you, the work of the foundation continued during a global pandemic and thrived thanks to your generosity. Because of donors like you, the AAFP Foundation endures and thrives as a meaningful, innovative, strong organization advancing the specialty of family medicine. That innovation and thriving spirit is highlighted in the growth and evolution of two of the Foundation's signature programs.
So Family Medicine Discovers Rhapsody is a really cool program where practicing physicians get the opportunity, the mentorship, and the financial resources necessary to investigate real world questions and answer those things that we all wonder about in practice and maybe don't always have the time to investigate. This program is designed to give them the time and the money to do that.
So my project was looking at medically tailored meal kits for patients with chronic disease, in both helping people learn, what foods are okay to choose, but also making the cooking and eating experience more like what it was prior to becoming ill with a chronic disease. The project itself made a very significant impact on my patients' quality of life, both in terms of receiving, 12 weeks of free fresh food, but also in having access to a community, and they were doing virtual cooking classes along with the food. So, especially in the midst of the pandemic, we saw their quality of life really increase. To the foundation donors, I would just like to say thank you. And I definitely wouldn't have ever thought to do this without the grant funding. So it's, basically changed my life.
The Rhapsody program has changed the way I practice. Life-changing is sort of one of those corny statements, but it's been fundamental. It's fundamentally shifted a lot of what I do. The project's called the Safety Study. It's a small pilot study. My dream is to have some future generation of primary care physicians not need to be an expert in taking care of long-term gun violence. And if we could properly and effectively screen youth, then we could have them access counseling. I could counsel them. I could refer them to counseling to help reduce the risk of gun violence. It's brought a lot of excitement and energy into the way I practice medicine, a lot of enthusiasm. I really can't thank them enough for their support and their belief that this would be helpful.
My project was studying the feasibility of auricular acupuncture or ear acupuncture in group setting for chronic patients in primary care setting. As part of my practice, I do acupuncture, and the demand is really, really high. I have found it very helpful to patients who have chronic pain. Would there be another model besides one-on-one that I can see more patients in 1 hour and provide more care? So that was the group setting model. And in the group setting model, historically, patients are uncomfortable to expose their body. So I had to modify the treatment. That's how I came up with the ear acupuncture. So you only put the needles in the ear. There's no need to expose the body and put it there. I wanted to see if I can do a model that insurance will actually pay for this model. Thanks for donating. Donations can really take us to the next level of creating new models, discovering new things, how we can practice, how we can serve the community. I want to thank them deeply.
Family Medicine Cares International Program, also known as FMCI, began in Haiti in response to the earthquake. Unfortunately, with the pandemic, the civil unrest in the country, and a few other factors, it caused us to take a pause. We ultimately found a new partner in the Dominican Republic, with One World Surgery, and we are actually working with them on their primary care endeavors in the Haitian Batays. There is a huge disparity within the country, especially with Haitian immigrants who have crossed the borders and have established their families now for generations, actually, in the country. In redesigning FMCI, we wanted to ensure that we were doing a few things. So one, we were prioritizing global health equity. That two, we were ensuring that we had a program that was sustainable and there was some continuity of care, which we were able to do in our partnership with One World Surgery because of the physicians that are employed locally by this organization who continue to follow the patients long after we're gone or after the other mission trips that come in are gone. We ensure that these patients continue to be seen and they have follow-up or access if required. The third priority we really wanted to ensure was that we were also building capacity. We are also hosting a day-long educational symposium in collaboration with UCE, or the Universidad Central de Este, which is one of their main medical schools in that part of the island. Thank you, and thank you. This is an incredible program, thanks specifically to our donors.
Because of you, the work of the foundation continues. The support of free health clinics around the country, the development of future leaders, the scaling of great ideas for primary care, the archiving of family medicine living history, all carry on because of your generosity. Thank you for your steadfast commitment to the foundation and our mission to improve the health of people through the values of family medicine. With you, we are better together, united for family medicine.